So we were talking about, well, how do you make change? You have to be the leader in many ways. You have to be planting ideas. You have to be going to the community. You have to go to organizations, to boards, to politicos, everybody. You got to deal with families. You got to get them interested, because as an effective change agent, you're the one that's throwing out all these ideas. It doesn't mean that you have to come out with the answer, because there are people in the community who will see what you're trying to do. They'll come up with even better answers. But you're the pusher. You're the person who's maneuvering, getting stuff ready, getting it into print, getting it into public. And that's where you're so valuable.
How do you get into the community, push into the communities?
Well, you start where you are, whatever base you're at. Say you're in a mental health clinic. You get to the highest person you can who will listen to you and tell them, you know, we have this situation. Now, I found something that I think we can do, which will help. So you start steps, but you show them. I'll give you an instance. When I was, my first job with county mental health, I was a social worker in this thing called community care. We went out into the community and dealt with our patients, not in hospital. We dealt with them anywhere they were, including in parks, under a tree, under the freeway. We found them where they were, and we gave them shot medication if they needed it. That's where we found them. And the doctor I worked for, David Owens, fantastic psychiatrist, he wanted to know, how come we have people in our board and care system, we're sending our people to the board and care, how come we get them back every 3 months? It's like clockwork. You know, I give them medication, they come back in 3 months. Why? He said, go investigate. So I go and investigate, and I said, did you realize, and this was in this would have been 1978, 79, 80, although these places were state licensed, state licensing was nothing like it is now. They didn't go to these board and cares and actually do too much looking at all. And the big thing was, there was no training required of staff. So I told David Owens, I have a plan. What I can do is create a training program, and I'll do it free, and I'll go to the board and cares, and I'll train their staff for them. Bang, I did that for 6 years, because training wasn't mandated until 1986. I got known around the state for that, so others began copying. Do you see how it jumps from one thing to another? And I think that is the plan. That is the person who is the agent of change. It starts from, why am I having a patient come back every 3 months? Now it goes to planting training of staff in these homes so they stay there, out of the hospital, take their meds. There are still problems you have in the board and care. You have to correct those, but that's the way you start. And it affects the community.